Welcome to Beyond the Limits with your hosts, me, Matt Clark, and my co-host, Mike Forsyth. Welcome to another episode where today we are looking at melatonin. Should we be taking this to recover from our jet lag? Should we be giving this to our kids? Should we potentially be considering this as an anti-aging medication or supplement? Welcome, Mike. How are you feeling about this episode?
Yeah, good. I've got to be honest, when we agreed to do this episode, I thought, and I think I even said this to you, it's a nice and easy topic. We'll do this one really quickly with very limited preparation needed. I think, as we'll find out, we've both gone down a little bit of a rabbit hole in terms of melatonin. It's actually a little bit more complex than we thought, particularly when we start talking about all of these anti-aging claims. My reason for wanting to do this was really because someone suggested it, and with this main question around sleep, both for themselves and for their children, because I think melatonin has this reputation of perhaps being a drug that is safe and is a lot better tolerated than some of the other sleep agents or sedatives that are out there. I think certainly, I'm sure you're the same, but I've been asked by patients a lot about this. It's also used extensively overseas, so I think an interesting topic to look at.
One of my old bosses was a surgeon. She had 4 children, and she talked about this flight that she'd go back to South Africa, I think twice a year. She talked about this horror scenario of having 4 children, all quite small, and trying to get them on a plane and trying to keep them asleep and things. And then fast forward 15 years, I've got a friend who's flying from America to Australia. She was telling me about how she picked up some melatonin gummies just in the airport, gave them to her 3-year-old, who then slept the entire flight. That triggered some jealousy, I have to say. I've been on an absolute horror show of a flight from Mexico back to the UK after our honeymoon. It was one of the worst experiences. A night flight with people trying to sleep, me with a rather large 1-year-old strapped to my chest, screaming, sweating, jumping up and down with him in the toilet, trying to get him to sleep. It was very much an unpleasant experience. So learning about a potential option to avoid such scenario, my ears immediately pricked up. And I was actually at lunch just last week when it came up in conversation. Someone had flown back again from the States, and she'd picked up 2 bags of these. I say 2 bags. They're not like suitcases, but she gestured to these 2 large containers that she got of melatonin gummies. It was buy one, get one free, and they're $18, and they're literally over 100 or something in each packet. This is readily available in the States. So I wanted to look into it more and really understand, is it safe? Is it a good idea? What are the risks? So let's dig into it, shall we?
Let's do it. Yeah, and I agree, and I think we'll get onto that, but it is the discrepancy, particularly in the United States, where it's essentially available in supermarkets versus the UK, where we as GPs are very rarely allowed to start it in terms of medication. We can continue prescriptions if it's been started by a specialist, but we can't initiate it ourselves. So massive discrepancy there. So yeah, Matt, kick us off. Let's just go back to basics here. What is melatonin and what is its physiological role?
Good. Yeah, so melatonin is a molecule. It's made from something called tryptophan, which is an amino acid. We derive that from, protein is built of amino acids. You can simply produce this from the gut. It's a very similar compound to serotonin. This molecule is amphiphilic, and I had to look that up. And what that means is it is water soluble and also fat soluble. It kind of moves around the body quite easily. It's amphibious in many ways. It is produced in 2 distinct ways, and I'll talk about the first kind of better known pathway or better known production first. So this is when we consider it as a sleepy hormone. So when your eyes are open and you're looking into light, the light comes in and it hits the back of the eye called the retina. That sends signals to a part of your hypothalamus called the suprachiasmatic nucleus. Take my word for it, I had to look this up, but this is the axis which essentially controls sleep. The hypothalamus then sends messages to a gland called the pineal gland. This is essentially your circadian rhythm or your body clock. And this is how the body adapts to light, telling you that you should be awake. And when it is dark, this axis or mechanism stops firing, and the pineal gland starts producing more melatonin. Melatonin levels in the blood actually don't exist when you're born. They start being produced at age 3 to 4 months. If anyone's had a newborn baby, it's very evident that a newborn, when they say that it just doesn't understand the difference between night and day, it's obvious, isn't it? There is no rhythm, there is no pattern, it's just chaos. And I guess that neatly describes it. Levels then peak at the age of 3, stabilise a little bit, and then after reaching adulthood, they slowly decline. It's well known that melatonin acts as this initiator of sleep, and I like to think of this as a bit of a trapdoor analogy. So you get flooded with melatonin, this opens a trapdoor, and you kind of fall through the trapdoor into a big comfy bed, and that's when you fall asleep. The melatonin doesn't have any ongoing effect in terms of when you're actually asleep. It doesn't keep you asleep. Now, the second way melatonin is produced, and this is new to me, so I had to research this, but I found this quite interesting. And melatonin is actually produced all around the body. It's produced by these parts called mitochondria, the little batteries of your cells. They produce the energy all around the body in all of your cells. These mitochondria are producing melatonin, and it's becoming increasingly known that melatonin has multiple other roles. It is a hormone and it does bind to receptors around the body, but in itself, it is a molecule that acts as a free radical mopper-upper. It absorbs and mops up oxidative stress, essentially. Now, this is where it gets a bit spicy, and I felt like I was opening Pandora's box. But melatonin is actually 400 times more prevalent in the gut, for example, than in the pineal gland. I think we're understanding now that it has more and more roles, particularly this one I talked about, of this mopping up of free radicals. Is this one of the mechanisms by which sleep is restorative? When you're sleeping, your body gets flooded with more melatonin, you're mopping up these free radicals. Is that why sleep is good for us? The way in which the mitochondria are the little energy factories around the body, it's also paramount of importance that the oxidative stress happens within the mitochondria. The energy production, I think it's going back to the Krebs cycle. So mitochondria are producing a lot of these free radicals. It's where the aerobic oxidation actually happens. And if you've got lots of melatonin around these little cells, mopping up all the free radicals, it is actually thought to be protective. Now enter biohackers guzzling melatonin by the bucket load to try and retard aging, ward off cancer, the list goes on. I think we'll move on to the evidence later.
As I said in the intro, there's a lot more to this than I initially thought. Also, the mention of the Krebs cycle has sent me into some sort of cold sweat and given me flashbacks of medical school. So hopefully that will be the one and only time that we'll mention it on this podcast.
I promise.
So yeah, melatonin, you've touched upon some of the uses there. If you talk about melatonin to most people, the association is sleep, right? And clinically, that's the experience that I've had. So people will come in and say, look, I'm not sleeping well. What are my options? Is melatonin an option? So that's certainly the most common reason that melatonin is brought up in these conversations. It stands to reason. I think you've outlined very nicely there the role of melatonin here. So if we think about then adding in exogenous melatonin and taking that at an appropriate time when you want to sleep, it makes sense to think that will aid you. Well, I've touched upon this already, but the interesting thing here is in the US in particular, this is something that is available over the counter, it's available in supermarkets, and actually you can just take it whenever. It's not licensed as a medicine, it's a food supplement. So essentially people are taking it, they want a good night's sleep, they'll pop a melatonin pill. This is stark contrast to the UK. So going back to those conversations that we have in a clinical setting, we can talk about options in terms of sleep. We may touch on this in a future episode, but spoiler alert, none of the medications for sleep are that great. They've all got quite significant side effects. They all can lead to dependency quite easily. But melatonin isn't even an option for us. So as I mentioned earlier, it can be initiated in certain circumstances by a specialist, usually a psychiatrist. And then as GPs, we can continue this. But certainly in answer to the question of can I have a prescription of melatonin for sleep, the answer, unfortunately, is always no. And this has always puzzled me a little bit because I think from certainly my knowledge of it, it feels as though the side effect profile of melatonin is quite good, or at least is better than a lot of the drugs that are available. It doesn't have a particularly long half-life, so the grogginess that people feel the following morning after taking sedatives shouldn't be too much of an effect. It's thought to be relatively safe, and we'll talk about that a little bit more later. And the evidence certainly suggests that it's hugely effective for jet lag, and that's another reason why people are requesting it. So it's an interesting dynamic where seemingly, looking at it from the outside, it's a drug that's pretty safe, widely available elsewhere, relatively good side effect profile, but we can't give it. So that's kind of where the situation is at the moment.
It's such a contrast, isn't it? It's fascinating how two quite closely linked nations with, very civilized, developed medical systems can be so contrasting on a particular topic. I find it shocking that this is considered a medical supplement, so isn't in no way regulated. And I think it's important to touch on the fact that that means anyone can essentially sell this in the shop, and it doesn't need to be really tested or proven. There's a study that I looked at basically showing the massive variation in concentrations in the actual active ingredient in the supplement that they were selling. And in particular, one provider, from batch to batch, we're talking about from 83% less of the active ingredient than quoted, up to anywhere to 5 times the amount of the active ingredient as quoted. So it's pretty wild.
Yeah, definitely. Just to add to my previous point, in terms of where this drug is being prescribed, essentially in the UK, it's most commonly seen primarily with neurodevelopmental disorders, so ASD, so autistic spectrum disorder, other forms of learning disability, and that's really where we commonly see it. So there are roles for it, and that's where it's licensed. But as we've alluded to, it's very different from in the US. Now, Matt, we were joking beforehand about how you seem to have drawn the short straw again and been tasked with looking at the research. So I make no apology for that, but tell us what you found.
The evidence for this is so vast, and I think when you consider what melatonin now does, like the range of effects, the range of pathways and actions that this molecule seems to have, then the implications of research and studies just go on and on and on. I will keep it slightly neat though, and I'll focus mainly on the sleep aspect of melatonin and the studies that have looked at that. I will preface it all by saying that the placebo effect is again quite a significant force, and I think anyone who struggles with sleep because of anxiety or from previous insomnia, having something that's there, just knowing that something that's there that might help, or being told that something can be effective, it is actually quite a powerful tool for those people suffering with insomnia. But looking at the evidence, so we're going to use this word meta-analysis a lot again. That essentially is a fancy word meaning review of lots of different studies, and it's considered quite a high level of evidence. So the meta-analysis in 2011 that looked at metrics of sleep compared with melatonin versus placebo increased something called sleep efficiency by 2.2%. Now that doesn't sound very much, does it? And it's not really very much. What sleep efficiency means is the percentage that you're actually asleep while you're in bed versus the periods that you're awake. It also found that melatonin reduces the onset of sleep by 3.9 minutes. And again, 3.9 minutes, is that particularly critical? I wouldn't say so. What I found more interesting, and I think this touches on why it's been licensed and why we're able to prescribe it, or why specialists are able to prescribe this medications in certain situations, is looking at those, like you said, with neurodevelopmental disorders. Now, across all the studies, the most compelling and significant finding was the reduction of sleep onset latency, and that total sleep time was actually significantly improved as well when compared to a placebo of those taking melatonin who had neurodevelopmental disorders, including autism spectrum disorder, learning difficulty, or even something called delayed sleep phase syndrome. I hadn't heard of delayed sleep phase syndrome, but this is essentially when someone struggles to get to sleep, say, for a couple of hours, and then they find that they're struggling to wake up for a couple of hours. And they might struggle to function, struggle to go to work. What it did also show, though, is that sleep awakenings were not affected. And I think this touches on to the previous mechanism, as we discussed before. It activates this trapdoor. It has no effect on the sleep architecture. In some ways, that's a positive. It doesn't actually affect your sleep architecture. It initiates sleep, but doesn't affect sleep. And I'm aware that some of these other Z drugs or some of these other hypnotics that we prescribe for insomnia can impact that and can in theory reduce the quality of your sleep. I want to touch on why I think this is important with those with neurodevelopmental disorders, because the reasons why they might struggle to get to sleep can be much more pronounced and varied. There might be lots of anxiety around sleep. There might be unpleasant scenarios where someone with a learning disability might not understand why they need to go to sleep, and the whole environment of getting into bed might be distressing and stressful when they don't understand how to initiate sleep. There may also be abnormal habits that are reinforced. For example, looking at screens, trying to get them calm looking at their screens, and we're aware that this blue light might actually be counterintuitive to them falling asleep. They might not understand why they need to sleep. It might not be part of their comprehension. One thing that seems to be missing from a lot of this evidence is that there is a big assumption that by improving the time in which someone goes to sleep, i.e. the sleep onset latency, or in fact the total sleep, that you're actually improving their quality of life. There isn't much in the way of these studies looking at cognitive benefits or health benefits after improving these metrics in sleep. I think it would probably be a fair assumption to assume that does improve things, but again, it's not really studied.
I think that is a fair assumption. It's interesting you talking about this delayed onset of sleep. And I did actually do some sneaky research myself and had a look at some of this. In recent years, there's been a lot more interest in circadian rhythms and the correlation with metabolism. So specifically examining glucose tolerance, your insulin release and sensitivity, weight gain, and essentially the timing of food intake. So what this said was that the circadian regulation of metabolism is in that sweet spot for people who are active, get plenty of light exposure and have their meals during the daytime, and who are in the dark during the nighttime. But in modern day in our society, many people are eating at irregular times, including late in the evening, during the night, and that's when our circadian rhythm is expecting us to be fasting. So there's a lot of interest in the theories that an evening meal will result in higher glucose and insulin levels compared with the identical meal eaten earlier in the day. And over time, these can cause elevated sugar levels and increase your risk for obesity and type 2 diabetes. So it's interesting that you mentioned that, because I think the timing of food intake in relation to our evening melatonin rise appears to be quite an important factor in this.
Yeah, that's a really good point. And look, I'm going to go one step further and say that the role of melatonin and the circadian sleep cycle is obviously fundamental to our existence, but the implications of the disruption of this are so broad and so far-reaching. I'm going to move on a little bit to try and summarise the evidence on all of the other implications. Melatonin has been implicated in terms of it can be anti-inflammatory, it modulates your immune system, it prevents cell death, it prevents aging of cells, etc., etc. The list goes on. There are some huge studies looking into this. In 2020, there was a big meta-analysis that claimed there is a statistically significant reduction in the total antioxidant capacity of blood when exogenous melatonin is given. Now that sounds great, doesn't it? You take a substance and all of a sudden you are reducing your exposure to cancer-producing free radicals. Looking into the granular detail of this study, I became more and more sceptical, and I think this is a good example as to why we need to essentially take these studies with a pinch of salt. There is no kind of proven benefit here in terms of you having more antioxidant capacity by taking this supplement. There is also an observation that people with psychiatric or neurodegenerative disorders have lower melatonin levels, and how replacing this or how supplementing this is in fact one solution. This, in my mind, is in some ways slightly flawed, because these patients are likely to have poor sleep cycles for a multitude of reasons, and therefore it's difficult to say that melatonin is causative or may in fact be helpful in replacing this. It is thought that if the sleep-wake cycle could be improved, for example, with people with Parkinson's or Alzheimer's disease, etc., then disease progression could be slowed. But unfortunately, the randomised controlled trials looking at this so far haven't actually shown any improvement in the sleep metrics after supplementing with melatonin. Mike, do you want to move us on and tell us about the potential risks and what are the potential side effects?
Yeah, it's an important topic to talk about in a little bit of detail. So I alluded to it earlier that melatonin has long been thought to be a medication that doesn't quite have the same significant side effects that a lot of the other sedative drugs that are available might have. But there are some risks, as with any medication. So I guess if we divide these into short-term risks and others, the short-term side effects, clearly a bit of drowsiness, going to be helpful for sleep, but the worry there is that excessive drowsiness can cause this hangover effect, drowsiness the next day, particularly if you're in a high dose, and that can have impacts if you're driving the following morning, for instance. Headaches, so quite common for people to report mild to moderate headaches after taking melatonin. Interestingly, I noticed this, so I've taken melatonin on occasion for various reasons, and yeah, I didn't particularly like it because I woke up with a splitting headache every morning. Again, N=1, and a very anecdotal report, but that is a side effect that I recognise. Other short-term side effects, so cause a bit of dizziness, a bit of nausea, perhaps stomach issues, as with a lot of these medications. Various other side effects that have been postulated. So there's a theory that perhaps an exogenous source of melatonin used particularly over a long period of time might impact your own natural development of melatonin. Now, I did a little bit of research into this. I couldn't find any convincing evidence that this was the case. But it's a theory that's out there. I think it would be quite difficult to prove, potentially. There's also theory that in children, overuse might interfere with normal development related to hormones. I think that's just generally a concern with any medication that we're giving to a developing brain. Again, I don't think there's the evidence there to say that conclusively, but it's a consideration, I guess, to think about. There's interactions with other medications. So if you're on a prescribed medication and then you take melatonin and it's not been prescribed and checked, there's a risk there that it could interact particularly with blood thinners, potentially with blood pressure medication and any other sedatives that are being used. Taking melatonin at the wrong time of day is not going to be great. So, I think this is particularly relevant for shift workers. So there's the theory that taking melatonin at the wrong time, it could disrupt that natural circadian rhythm and make sleep problems worse. I mean, there's an argument to say that shift work is disrupting your circadian rhythm anyway, and is generally not very good for you. But again, a theory that's been put forward. And then there are some risk factors for specific groups. So melatonin safety hasn't been established for pregnant or breastfeeding women. We don't understand the long-term effects of melatonin, particularly on children. There aren't those studies that can prove conclusively that is safe. And I guess another consideration with children is the risk of overdose, of accidental ingestion.
Yeah, I just want to touch on that, because I read about a PEDS emergency department, a guy called Tose. He looked at this, I think maybe because he was becoming more and more aware of children coming in and parents concerned about overdose. I don't know if this is to do with increasing awareness of melatonin, increasing access of melatonin, or just increasing use of melatonin, or a combination of all of them. But there was a 500% increase in contact to the Poison Centre, which is a kind of advice centre in the States and internationally, asking about melatonin overdose in children. Most of these children, I would point out, were fine. However, some of them weren't. This study found 260,400 cases of melatonin ingestion, and nearly 300 children required intensive care. 5 had to be put on ventilators, and 2 children died. Now, it didn't actually say whether or not the infant drank or found the substance, and where it comes in gummies, tablets, liquid. I guess the concern is that very small children would find the liquid and drink that, but I guess that does highlight that this is not an inert substance and can cause a lot of harm.
Now, Matt, I want to wrap it up shortly and really bring us back to the question that we've been trying to address through all of this. I think all of the research is really interesting to think about, but ultimately, what I want to know from you, does this change your opinion on melatonin? What are your takeaway points here?
It does, and I have to admit, it's not something we prescribe here in the UK as GPs, and I didn't know a huge amount about it. I've been impressed by some of the data about this reduction of sleep onset latency in certain conditions. Definitely, I mean, both you and I used to work shifts in A&E in Australia, and that feeling of coming out of a series of night shifts and then just not being able to reintegrate into society is awful. And if there is a pill that can help readjust your circadian rhythm and reset that, then I think that's incredibly useful. I also became quite interested reading about its proposed benefits in reducing oxidative stress, reducing aging, anti-inflammatory, all of those things that are unproven to date and are difficult to prove, will require long studies. There are loads of biohackers who are taking this in high doses on a regular basis, who are not doing it on the basis of any evidence, and are just doing it on theory. So it'll be interesting to see kind of what happens to them, although they're taking all sorts of other things as well. My concluding thoughts are: could you just achieve what melatonin does without taking the pill, i.e. being wise with blue screen filters, timing your exercise, getting sunlight when you need it, cooling your bedroom down, understanding when and when not to take caffeine? Obviously, those things can all help and help sleep hygiene, and often people are doing those things wrong. But obviously, those special circumstances with children with neurodevelopmental disorders, this obviously can be helpful and is proven to be effective in those scenarios. What are your thoughts, Mike?
And I'm glad you said that. There are clearly scenarios where this is hugely beneficial. It's got evidence base, and we're talking about these neurodevelopmental disorders in a lot of cases. Now, my takeaway point from this is you mentioned the sleep hygiene measures. So there's not using your screens 90 minutes before bed, the exercise, the sunlight, everything you mentioned. I think I tend to get a reaction of people roll their eyes at that and think, well, obviously I'm doing that already. Give me the good stuff, And I think we can't downplay the importance of good quality sleep. A lot of us are not getting good quality sleep. Now, I think that all of us need to be much more aware of the sleep hygiene measures. I think probably all of us have pretty poor sleep hygiene. Look, melatonin is probably safe. I think, to put it bluntly, I think of the sedating drugs, it probably has the better side effect profile. But I'm just generally not a fan of hypnotics and sedatives for sleep. I think addressing this in a much more non-medicinal sense is the way forward, as hard as that can sound and seem. I would also be very cautious about using this regularly with kids. As I said, in certain circumstances, it's very important. But I think just because my child doesn't sleep very well, I think I would urge a lot of caution there, given the uncertainty about what effects it has long term. I think there's so many other things that can be looked at first of all, and that's not to downplay how difficult it is, because I'm no firsthand that's the case. But yeah, I would be urging a significant amount of caution with melatonin.
Experimenting with something that's unproven on a convenience basis to help them sleep because it's easy and it works. Experimenting with your child when something that's unproven and we don't really understand the risks, specifically when taking long term, that's definitely something that I'd urge to avoid. I think that's a really good concluding remark.
Good stuff. Matt, enjoyed that, and see you next time.